So let me start like with my experience about the EasyPrep today. You know, like in our area, like because I guess that all of us are the dentists like in here, or some of you might not, but work in the dentistry field. And I think in dentistry like field, in our field, what we hope for or what we want, like to see is the dental isolation. It doesn't matter you're gonna work with like the restorative work, surgery, or any kind of like area. If it's related to dentistry field, you want to get the dental isolation. You want to isolate the tooth from everything else in the mouth. If you have the tooth like this, okay, you have to, for example, if you have a dental form, it's so easy. You can like, tilt it in like any way. You can like, prep it just to see the prep like very easy. Just imagine, like, think about it when we are in the first like, year of the dental school. The teacher or the professor just, give you the dental form. They ask you to prep it. You feel like, well, it's so easy. It's very easy. You can like, just prep that. But in reality, when you prep the tooth, it's not that easy. Some patients are so difficult. Their tongue, cheek, and everything. It's like, you have to work with the patient's like mouth opening as well. Sometimes it's so difficult. And I'm pretty sure all of us have been like experienced with like sleeping patient. You feel like, I'm not that gentle, but why does patient like sleeping all the time while you're working? And you want to find something to hold their mouth like open. You keep saying, open please, open please. They keep like, falling asleep. And it's so difficult to work with this kind of patient. And this is the oral cavity. I feel like it's so, I rather work with the top teeth more than the bottom, because working the bottom teeth is so difficult. You have to, like the patient have the tongue, you can't cut them. The patient has saliva, the patient has cheek, the patient has lip, and also like sometimes the patient has like, the bone exostosis as well. It's so difficult to work with the patient. I've been working with a regular patient for years until I went to MD Anderson. In MD Anderson Cancer Center, I mean, not luckily, but like, luck, I was lucky to be able to experience, to treat that kind of patient. But one thing that I really missed when I work with cancer patient is all of their mouth is so dry. I've been working there for a while. Some patient doesn't have the tongue. Some patient doesn't have like, part of their cheek, part of their lip, and it's all dry. You don't have to be worried like using a suction or the Howell suction to do it. However, when the patient doesn't have tongue or cheek or even the lip, it's so difficult to work with them, because you can accidentally like, drop something or fall something in their throat like pretty easy. So I've been like, thinking about, okay, I should have, something that's so easy to work with this kind of patient. But back at that time, I would say like almost 10 years, we don't have like this kind of tool. Back at that time, when I work with this kind of patient, I have to use like a big pack of the gauze to pack their throat. And can you imagine in some patient that they don't have tongue? When you pack the gauze in their throat, you have to be really careful not drop the whole bunch of the gauze into their throat or their lung. So it's so difficult. And in reality, when we work with the patient, like I said, you use a burr, go ahead and like, prepping the tooth. Just imagine the patient's mouth, or all of us mouth, like my mouth, it's so tiny, like very small. It's so difficult to work. If I want to prep the crown, I have to use like one hand, retract the cheek. And my assistant, they have to be very, very good, to retract the tongue and help me. And I have to use a burr. And once in a while, I cut the patient's like fourth mouth, or once in a while, I cut the patient's cheek or the tongue. I have to admit it, because it happened to all of us like all the time. And sometimes it's not so easy, when you go to like, for example, when you go to distal of the second molar, you tell the patient, hey, keep opening, stay still. Okay, I have a very sharp instrument. Stay open like just for a second. Once you start like prepping, they close their mouth right away. And it cut like, their cheek or their tongue. So this kind of thing, like it make me kind of like wondering, should we have like, some tool or some device that help us to like, get a very good dental isolation that I can actually like, focusing on like, prepping the teeth or like working with the patient's teeth. If, ideally, the best dental isolation that everyone have been saying, it's you putting the rubber dam. I mean, like, even right now, I agree, rubber dam is like, it's the best, If you can put the rubber dam, please go ahead and do it. But in the real world, not everyone like, prefer to put the rubber dam. Sometimes it's so easy, it's so difficult. And also it add more cost to the patient or cost for the clinic as well. Even though some patient or some dentists, they're probably gonna say like, rubber dam is so cheap. Okay, well, you're right, it's not so expensive, but not everyone like, are very good in like, putting in rubber dam. And some situation, you can't really put the rubber dam on it. For example, if the patient comes in like this, okay, you want to remove the caries. The patient have a big cavity. You said, okay, I'm gonna remove the decay, and then the patient's tongue is everywhere. The patient's cheek is everywhere. The patient keep like, falling asleep. What are you going to do? How are you going to put a rubber dam in this situation? I mean, you could, but it's not easy. You have to like, admit this. And this is a picture that I received from my colleagues. She sent me the picture. I look at the picture. I said, well, okay, fine. It's like this patient is our patient. Okay. I said, how's everything? She sent me this picture, and I asked, like, everything is fine. She said like, okay, yeah, the crown is fine, the contact fit fine, oxygen is fine. I said, well, and what happened to the patient's fourth mouth? He said, well, this patient, it's not easy. I was the one who placed the dental implant for her, and my colleagues, she was the one who did the restorative work. She said like after she put the dental composite, to cover the hole, and the patient accidentally like, her tongue, the patient's tongue is like, flipping the other way. So the dental work actually cut the patient's fourth mouth. Luckily that she can, stop the bleeding, not so difficult, and also like, put some stitches there. So when I saw this kind of picture, I was like, okay, we have been working in the risky zone all the time. There should be another way, or there should be one that we can like, play the tooth and the tongue out and focusing on like, working on the patient's teeth. And because, I've been working both surgical, dental implant, and also restorative work. I did the dental extraction by myself as well. So, imagine the patient came in, has a root fracture. The tooth number, I'm not sure how you guys in Taiwan call this, like, but the central incisor. However, this tooth have a crown and pulse and core, and then you grab the tooth, it's like, oh, okay, this is a traumatic tooth extraction. You pull it down, and then suddenly the crown and the pulse is just separate from the root, and it falls into the patient's lung or GI. It could happen. This is not my case. Luckily, like thankfully, this is not my case. I found this picture on the internet, but this is kind of like, worried me that this kind of thing, like it could have happened to me if I'm not really like carefully like extract a tooth. Or this kind of picture, this is not my patient as well, but I have a, like bad experience about the screwdriver. Back in like 15 years ago, 16 years ago, I would say, when I was in the first year of the post residency, I have been working with the patient, the implant patient. And then I was taught at that time, okay, you use a screwdriver, you have to be really careful. you have to put the gauze, pack the gauze in the patient's throat. And then don't forget to tie the floss to the screwdriver. I did everything just like my professor said. I put the gauze, the patient was gagging. They said, oh, I can't. Okay, I took it out. I tied the floss, like make it like really, really long. And then you know what happened? I dropped it in the patient's throat. But I have a very long dental floss in my hand. Like I can say really, really long, like this long. I tied it with my wrist. And then I told my patient, hey, hold on, don't move. I turned in the other way. I was going to grab the dental faucet, try to catching the screwdriver. You know what happened? She was a nurse. She stood up and then she was doing like this. Don't worry, doc, I already swallowing. I said, what? Okay, now I worry. What have you done? She said, no worry, I didn't aspirate like anything. I actually swallowing. I said, okay, the dental floss is here. She swallowed thing, and then I have like very long dental floss like on my wrist. So we actually walk together. The screwdriver is in her esophagus, and then the floss is in like my wrist. We walk together like that to the other side of the hospital. And then my friends, like my colleagues at that time, he said you can just pull it over. And then I said, really? Can I? And everyone come and look at in my unit, should we? And then my instructor come in, almost yell at us, stop what you're doing right now. When you pull the screwdriver up, the patient can have a GI rupture. So just hold it right there. So turn out this patient, we have to put her in sleep, and then we have to scope. So never forget about this experience, and I keep telling and teaching my students all the time. I kind of to me, I don't like the put the dental. You still have to put patient in sleep anyway, and then just scope it and take it out. Why don't we just find something to block it? You guys might have said, okay, put a dental floss, but like I said, it's not so easy. And some patients, they don't feel comfortable when you put the throat in. When you work with the patient, it's so funny. Like all of us breathe through the nose. The patient, they can breathe through your nose, but whenever we put them down and start prepping, they said, oh, I can't stop, I can't breathe. Keep telling them, hey, you don't breathe through your mouth, you breathe through your nose. They can't. Sometimes it's and it's not that simple work. Some internet as well. The screwdriver is right here. You can't really wait until the next morning and come out. It's not like some GI doctor is that it's not safe. If something like this, might have to really scope it. And this picture, this is just an example. Then when you want to take the very mobile teeth, and this is like a hopeless bridge, you section the bridge, you try to remove it, the extraction. That situation happened to the first picture that I show. The root and the bridge just separate. What happened? The bridge is right here. You know what happened? Because the faucet, it's slip. You grab the root of the tooth, but the whole bridge, it's separate, and the patient aspirate or swallowing. So this kind of thing is the picture that I want to show you, that in our field we are working in the risky zone all the time. Like I said before, sometimes you put the bite block, you put the gauze here, but the patient, they can't really breathe. And I'm pretty sure all of you, just like me, we have done this. You put the gauze, you pack and make sure everything's fine. But once you start prepping, the burr is actually like, grab the gauze and it's spinning. The patient hurts or you hurt the patient. So I have to be really careful. I don't really like to put the gauze in the patient's throat because, like sometimes they don't feel comfortable. And the bite block is the tool that all of us have been using for years, and me myself too. It's a silicone block. They come with like a different sizes. You ask the patient to open their mouth. They put it you put it in the patient's mouth so you can work with the patient. However, the bite block is a mouth prop. It's just like the silicone or the plastic thing that asks the patient to open. However, the bite block can't really separate or can't really isolate the tooth from the tongue and from the cheek anyway. So that's why I'm still like I'm been using bite block, but I'm not that happy with the design of the bite block that I have been using. So I've been like searching, put bite block on Google, and just fine. They come like 100 shape. I've been looking like each one of them. However, I still can't find the right one or the one that I prefer. So let me talk about and let me tell you about the story how I got to use the EasyPrep. I've been talking with my director. I said, well, I I think we should have like some tool. I think I remember I've been using it in the United States, but I wanted like, to use in Thailand, and it's so difficult to find. So one day we flew to Taiwan. I took the course with the Select Asia. And then we saw the sample of the EasyPrep. I said, wow, I really like it. So, I was like, okay, I want to use it. They're kind enough to give us couple of samples. Okay, go ahead, try and use it. So my director brought it back to Thailand, and I've been using EasyPrep since then. I really like it. So that's why my director and myself asked the KSH, like, SH, like in Thailand, to brought it in Thailand and using it because I really like it. And I think this is a tool for every procedure and it matches with everyone. So let me talk about a little bit about the incidents or the unexpected like hazard that happened with the dental high-speed drill. This paper, I found on PubMed as well. I think from the high-speed drill, everyone, could, if you work like, long enough, you're gonna experience that, when you use the burr, sometimes the dental burr, it's start like worn out and it's not grabbing the the dental burr or the diamond burr. So sometimes if you can, you stop it in time, sometimes it's, and put the patient's like she drop it in the patient's mouth. I have like this article that talk about the iatrogenic trauma to the oral tissue. That means the trauma that could happen is not happen from the patient, like, walk and hit something else. It's happened from us. And this is the article that I think it's really, really interesting. And I look at this article and they said like, they give us many charts that talk about common injury that could potentially happen to the patient. Just look at the common type of the injury that happened in the patient's mouth, and almost 60%. When you look a little bit more, they look at the procedure that most likely to cause iatrogenic injury is a crop preparation. It's our work, okay? And when you look more, iatrogenic damage caused by the respond is a burr. So you need to really find some device or some tool to help you to eliminate or reduce the damage that could happen to the patient from us or from the dentist. And common site of iatrogenic damage is the mucosal and gingival. Look at the technique to prevent iatrogenic error. They said like most useful technique is carefully handling of the instrument and material. I feel like I know I have to do like that. I have to be really careful. But sometimes the injury that could happen, it's happened that that happened and we can't really control. And when you look at the another column that said proper isolation, there you go. That confirm that you have to really find a tool to do to give the tooth to do the proper isolation, either rubber dam or something else that could like isolate the tooth from the patient's throat, patient's cheek, and patient's tongue. And I found EasyPrep, of course, I've been using this, I think like 1 or 2 years already. I really like it. It comes with like different version. Right now, at the very beginning, when I got like this, at the very beginning, I got it for free. So I use it. And then I gave it to my assistant. I said, okay, go and then clean it. She asked me, hey, how are we going to clean it? I said, okay, that's right. So I emailed like Thomas and asked like, how are we going to clean it? He said, oh, it's a single use. I said, what? Okay, I'm not like that rich. It's so expensive if you use it like for single use. So like, I'm so happy that this day they came out with the version is autoclavable. It's gonna be very, very useful and like eco-friendly for the every single clinic. And right now they have the light version as well. Sorry, I have to be honest with you, I'm not a big fan of the light one, because you have to connect the cord with the light, the light thing all the time. So I feedback this to the KH as well, that you should have like the battery like installed in the connector, and I think they're working on that. However, I heard the feedback from some other people. They said like they have no problem with using the adapter with the cord. I said, well, that's fine. The reason why I have no problem, because I use it and I use a loop with the light too, so it's fine for me. I'm really happy with the EasyPrep. Even just by itself, I will show you some video or some clip. I just use the EasyPrep without the connector, and I use it for most of, I would say like every procedure, every dental procedure that I use with the patient. This is the EasyPrep design. I think like most of you, when I look at the list of the patient, the dentist name here, I think you guys like familiar with the EasyPrep already, but you guys just want to try like, okay, just buy one box. I just want to see like how it goes. I would say 100% of the dentists who spoke with me, I asked the feedback, how do you like it? Everyone like, they love it. The reason why they really like it, because the material, I think the best thing of it, it's really, really soft. And what I really like it, it's clear. When it's clear, you can see everything. Just imagine you put this kind of thing in the patient's like, mouth. You actually like, want to see it. Sometimes if you use a bite block in the black color, if the patient has some bleeding, you don't really see it because it's hiding like, underneath the black bite block. But if you use the clear one, if the patient has some bleeding or some like other problem, you actually, can see it very easy. And the good thing, or what I really like about the EasyPrep test, it's modified. They have the bite block, and they put some cheek and tongue separator, connect with the high power suction as well. So I'm gonna show you in the picture in the clips like later on, that it can give you very, very dry feel. And this is the first case that I use the EasyPrep. This the patient is my niece, so I'm fine to show this picture. I used her as a subject. She was really, really scared of the dentist, so we put her in sleep. In that day, she did like so many procedures. She did the wisdom tooth extraction, root canal treatment, crown inlay, onlay, filling, scaling. like many things. And one of like our tool that to do the isolation is the EasyPrep. Yeah, she was like, sleeping at that time. You can see we did the dental extraction, we do the crown, we do the filling, scaling. I use like EasyPrep, and it gives the patient, it gives me really, really dry feel. This is like how I put the EasyPrep here. Okay.
Because it's really
this
soft. You
is
can actually like,
video.
Really
I just
soft,
want to show
really
you
soft,
how I
it's
put the
soft
EasyPrep.
everywhere. So the patient is really comfortable, like, with this one. Okay, when you want to put it in the patient's mouth, or so for example, if I want to work on the patient's mouth on the right side, so the patient will like actually like bite on this one. The teeth on the left side will be like, biting on this sidewalk. And when you put it on, you actually like, put it in this way or this way, and then twist it a little bit. For example, like this. Okay. You actually, put it in like this. It's pretty easy and simple. You can like, use this one. What I really like about this is it's actually, can help you to prevent the cheek and the tongue, because, most of the time when you're working with the patient, the patient's tongue is like everywhere. And also the lip and the cheek as well. It's like, in a way of working. I'm using the EasyPrep not only for the restorative work, but I also use for the surgical part, which I'm going to demonstrate like later on. When you use the burn, you can see you actually, ask your assistant, or you can actually like, connect it. I usually like, connect it later, and then I'm gonna close it first. And close it first. Let me show you how to put the burr. It's really easy, and actually, help and maximize the visual, the vision of like, working in this like area. Even for the like second molar, you actually, can put the burr like straight to very easy. And then you can like, angle your burr like everywhere, both top and bottom, like this, no problem. Okay. Not only that, for the scaling, actually, you can like put the EasyPrep and do the scaling also. What I really like about the EasyPrep is, you can like try to turn on, and then I'm gonna pour water in it. You actually, can see that the water can be like disappear very easy. So the patient gets feel like really comfortable, and they feel like really dry in the throat as well. Okay.
So I asked the patient, when I pour the water in, I asked the patient, do you really feel that the water like go through your throat? She said like, no, it's really, really dry. And what you have to be really careful is, because it's really dry, some patients, like I think I would say like most of the time you have to put the Vaseline, or the petroleum gel like all over the patient's lip as well, because you put the suction, you connect it like with all the time. You work with like very, really dry tooth. However, when you look at the patient's lip, it's all dry. Just, don't forget to put the petroleum gel or the Vaseline in the patient's mouth as well. And I also use this with, like my restorative work as well. When you use like me, I use the Omnicam. So kind of like, it's not easy to scan it if the patient's tongue and the patient's cheek is everywhere. Even though in some oral scanner, they advise that scan tip is pretty big. They can use a scan tip like, push the tongue and push the cheek. No need to ask the dental assistant to help you. However, I feel like it's still easier, to put the EasyPrep in. And I use the EasyPrep for both like Omnicam and iTero. Even it's really big tip, I can still like, put the iTero tip with the EasyPrep as well. You can scan it like this, and you can get like really, really dry feel. Okay, and another procedure that I really, really like it, I recently used it with the dental implant procedure. that, like I can connect the EasyPrep with the high power suction, and then I can use the only one assistant to put the suction tip like around and then suction the blood like just a little bit. But I can separate the patient's tongue and the patient's cheek, and I'll, I just want to make sure that the field of operation is dry and less contaminated as possible. So you can see I open the flap like very little. Yeah, I put the burr like start drilling. This is for the first molar. I have no problem, and I can actually like angle the burr like straight, like no problem with this. Sometimes when you work with the like dental implant like surgery, you turn around and you want to grab another burr. You turn it, then again the patient closed their mouth already, or the saliva is like all over. I don't like it. I usually like to work with a very, very clean feel or less contamination. I'm gonna speed it up a little bit. And just imagine in this, okay, let me, in this step, sorry. Oh, in like, in this step, I put the burr and I was going to take an x-ray. I don't have to like scare that the patient going to swallow the drill or the depth gauge that I have in the patient's mouth. And this is like the final drill. And this is my favorite like part. When I put in the dental implant, I want to make sure that there's no saliva in like, my field. And plus I want to, I like it when the patient's tongue is not like on the way. So I have very clear field to look at the osteotomy site and then, slightly like gently like, put the dental implant on. If I don't have the EasyPrep, it's gonna be so difficult for me to work. And also when I put the screwdriver, just like I mentioned at the very beginning, it's gonna be so difficult because I have to be really careful that the patient is not, swallowing the screwdriver or something like this. So I think this is the best part of the EasyPrep that I found that it's most useful with the dental surgery. You can see I capture like some picture. Want you guys to see it clearer that you have a better view or better feel of like doing a dental surgery. And this is the moment that I put the dental implant. I have no, I don't, I have no tongue and the cheek in a way. I can like just focusing on the osteotomy site and gently like put the dental implant in. Okay. All right. This is the size of the EasyPrep. This is the picture that I got from Thomas that, they come with like two sizes, the small and medium. Many people ask me, okay, they should buy the small or they should buy the medium. I said, buy both because you need both. Just like the bike block, you can't have only small size. You have to have both, and it's different. And the shape and everything is exactly the same, except the size of the height of the bike block. It's slightly different. So I would suggest that get both of them. Okay, and during this pandemic, everyone know that dental treatment. It's one of the things that we kind of like back up a little bit and ask ourselves, okay, should we continue and work with the patient or should we stop? I'm not sure in Taiwan, but in Thailand we are decided to see only emergency patient in last couple months. But this time we start like getting see more and more patient with like just like regular setup, but more precaution. I have been lecture about this topic, and I keep telling everyone this, you can see the patient, but make sure that your clinic, you have this kind of weapon. You have to have a rubber dam, you have to have the proper HVE, and you have to have the dental isolation mouthpiece. I cooperate the EasyPrep to be one of my weapon. I have to make sure that the clinic or the office that I'm working with, I have teeth free. And I have to have the experience, like, the assistant as well. I found this picture on the internet as well. I really like it. It feels like so funny. When you want to put a rubber dam, some people like you can put rubber dam everywhere. Really, like I said, sometimes you can't really put rubber dam in some like specific area. And if you want to prevent, if there is like a pandemic, if there is a lot of active case, I rather not like seeing the patient or see only emergency patient. You can't really prep the patient like this. Or I give the lecture about like putting rubber dam as well, because in the past they said like, they want to prep the crown and they want to know how to put the rubber dam. I said, oh, for the crown, bridge, veneer, you can do the split technique. This is like my preference. I put the hole there, I put the clamp first, I clamp with the molar, and then after I put the rubber dam, I use a scissor and then split everything, and then I can start like prepping the crown. However, just like I said, in some situation, you can't really, clamp it. For example, if this case, I want to do a crown on the first molar, how am I going to clamp it if the patient doesn't have the second molar? So it's not possible. And one of the weapons that I would suggest that everyone has to have the proper HVE. For Thai people that have been like, hearing or listening about this lecture, I was like talking about the property of the proper HVE that we should like incorporate like in our like clinic already. And this is the third weapon that I would suggest it. It's the dental isolation mouthpiece, or the EasyPrep. That, like I said, this is very useful. And this is okay. Some people, they actually have a problem. They said like in some situation when they put in the patient's mouth, they said it's the corner or the edge of the EasyPrep, it's really like cutting the patient's like the bone or the tuberosity. What am I going to do? I was like joking. I said, you cut tuberosity first before using EasyPrep. No, I'm not going to ask you to do that. However, I use a scissor and modified it. Like I said, it's so soft, it's so easy. You just modified it and then keep it. Just like when you have a tray. When you have a metal stock tray, sometimes it doesn't fit well in the patient's like mouth or patient's arch. You still use a tool, twist it and modified it to make it bigger, to make it more a little bit expand. EasyPrep as well. I cut it and I keep it like autoclave it, and then I use it with the other patient. You can modify it, no worry. Okay, and it's not that expensive, so cut it. Okay, this is the picture that I got from Dr. Sompot. He took this video, this clip. This is when you put the EasyPrep, turn the EasyPrep on, you're gonna see that a lot less of the splatter or the aerosol. Especially if you use with the external oral suction, you can like eliminate or reduce the number of the splatter or the aerosol, pretty clear from this video. So lastly, I would want to summarize the benefit of the EasyPrep is obviously it's a dental isolation tool, and it's reduced the number of assistants. For me, when I do the surgery and for a single dental implant, I have to have 2 assistants, because I don't want my assistant to take out the surgical glove or the sterile glove and then grab everything. So I have to have 2. But after I have EasyPrep, I've been working by myself in the patient's mouth, and the patient just, kind of like, hand me the instrument. I reduce the number of the dental assistant. And obviously from the clip that I showed you earlier, that it reduced the number of the dental aerosol or the dental splatter. It maximizes your vision. It's safe because it reduces or it eliminates the iatrogenic trauma, the patient swallowing or aspirate the dental instrument. It saves time, save cost, and increase the patient comfort. Lastly, I want to show you the video. Some of you, when I give the lecture or I teach you how to use the EasyPrep, some of you might have said, it's so difficult to put the EasyPrep in the patient's mouth. I said, it's not difficult at all. And this is Tiara. She's my kid. I want to show you this video and how easy to put it in.
This is for kids. I really like it, and it's so soft. I can show you how to put it in.
See, if she can do it, all of you can do it. It's so easy. All right, thank you so much for today. Let's see if anyone has any question, okay?